Nurse TV, brought to you by Hester.
You sort of know being on a motorbike is not really a safe thing on the road, and a lot of cars don't respect them. And one day I thought to myself, if he's going to be involved in an accident, one day it's going to happen.
Had a girlfriend coming over for dinner, and we were just getting ready, everything. And then there was a knock at the door. I was a policeman. I didn't even think about it. Nothing at all. I thought, oh, God, what's he done? Like that. And it was a policeman asking me if I was related to Dwayne. And I said, yes, I'm his mum. And he told us that Dwayne had been in an accident. And I don't remember too much after that because I didn't blank out, but I sort of went into shock. First thing that comes to your mind is if to say, well, motorbike accident, he's not going to come up pretty good out of it. Just thinking, how bad is he? What's happened? Just thinking, what are we going to see when we get there? The first thing we tried to find out from the policeman was he okay? And the policeman said he couldn't tell us at this stage. And he just said, look, I think it's about, you should just go to the hospital and go and see him right now. So we packed up all the stuff and just went to see him.
It was certainly a busy day, and I recall receiving the message that a critically ill patient was being brought into the emergency department. I remember the patient being brought in by the ambulance crew. It was certainly apparent from the outset that he had severe life-threatening injuries to various body parts. He had an altered conscious state, and there was a great deal of concern that he wasn't able to breathe properly. So our first priority was to actually put a breathing tube into his trachea and protect him from any vomit that might get down into his lungs, and also make sure that he had adequate oxygen supply. He also had a severe injury to his chest. He had collapsed lungs on each side and rib fractures on both sides. So those injuries needed urgent treatment to help his breathing. Also, he had a very low blood pressure due to severe fractures of the pelvis, and he needed to have intravenous fluids and blood, as well as an urgent transfer to theatre so that that fracture could be actually stabilised to prevent further bleeding.
He had pretty extensive peripheral injuries, but no spinal injuries at the time, and no neurological injuries that we could tell at that stage. But he'd had a puncture wound of one of his knees, and I think he'd broken his clavicle, but the thing that stuck with me the most was he had a open book fracture of his pelvis, which I'd never seen. So he had external fixators to keep his pelvis in place, basically. We didn't know whether he was going to survive it or not, because they did say he had multiple injuries, it was a multi-trauma. And that was a bit hard to sort of take at the time. Well, we couldn't see him. They told us that he was in surgery, and we sort of tried to find out as much as we could from anybody that we could. Well, I think we got to the hospital at about 5 o'clock and didn't actually see him till about 1:30 in the morning. One side of his face was just completely covered in blood and cuts and grazes, and his whole body was just swollen. He was just hooked up to so many, different machines. It was a bit of a shock to the system to see
everything was just connected up to him and was just like nearly unrecognisable to look at. And it sort of hits you pretty hard when you see something like that. But your mind just wanders off to think, well, is he going to be there? Is he going to survive? It's something I can not look back on. I wouldn't want it to happen again. It's just very hard to take.
I was coming back from a motorbike shop, meeting some guys from America, the Crusty Demons of Dirt, and which I don't remember meeting them at all. So I got the signatures and all that of this T-shirt I'm wearing, and that's it. Like, yeah, and I was coming home to meet some friends who were racing on the day, and I never made it. All I remember of the accident is just lying down on the ground, just screaming I was in pain, and some guy, I'm pretty sure, unless I've dreamt it, came over and said, "Don't worry, mate, ambulance are on their way." That's all.
We were told that he didn't have any brain damage at first, but it was after, I think it was about after a week, they realised that he wasn't responding too well to commands.
Well, the doctors said that he might not be able to walk properly. With his head injury, they said parts of the brain which was damaged. He might not be able to talk properly. He might have a problem with his eyesight. And each day we were at the hospital, they seemed to find something else, and then something else again.
I don't remember anything from intensive care except for one of the nurses' voices. And that was it, because I was out cold for 2.5 weeks. She had an accent, and that's all I remembered. Like, when I went back to visit the doctors and all that, and the surgeons, and I was just like, I looked at my mum really weird, and she goes, "What's wrong with you?" And I said, "I remember her voice," and that's it.
I think all up, I think he was in hospital for 6 weeks. 16 days in intensive care, and I think the rest was in the ward.
Dwayne was on the general surgical ward, and he had broken everything practically from head to toe. He had a tracheostomy, which is a breathing tube in his throat, which he needed regular suctioning from because it needed a lot of care. He needed a lot of pressure area care because he couldn't move himself. Just general things, like everything. He couldn't do anything for himself.
Just like, I remember the first time, like, I sort of woke up, I was out, drowsy and all that, had some friends there, and had Michelle there, and, like, I met her, she was like the first nurse I met, and she goes, "Oh, hi, I'm Michelle, I'll be looking after you, okay?" And I'm like, because I had a tracheotomy in, and I'll be like...
She'd explain everything to us about what they were doing, if there was anything wrong, if his temp had gone up, just anything. She'd explain everything to us. She was really, really good.
Well, basically, Dwayne was really interested in cars, and I know a lot about cars, and so that was the first thing that hit it off. I saw a big photo of a car, big Walkinshaw on the, up on the wall, and he still couldn't talk to me because he had the breathing tube in, but I'd just yak, 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 drive him mad and talk about his cars, and then his family would come in and they're all on about that, and every day I'd tell him, "Oh, this is what I did on the weekend," and, talk to his friends, and he'd always respond to me, like laugh or nod his head. And as things got further down the track and the breathing tube came out, he used to tell me, "Oh, I had the biggest drink, before this happened," and it was just good.
She'd come into my room, like, she'd start at like 8 o'clock or 9 o'clock in the morning. She'd come into my room like 45 minutes early and go, "Wakey, wakey," and be talking to me for like an hour and that. And when she was on duty as well, she'd be still coming into my room. She goes into my room, she'd go, "Oh, got to go now, I've got work to do."
It was very important for Dwayne that I treated him like a human, just like not another patient, because he was young and he had a major accident. And every time he saw me walk past, he'd be waving and come here, and want to know, what the goss was happening on the ward and stuff like that. I like to form relationships with my patients like this because it makes them feel good. They don't want a nurse that think, "Oh my God, not her again." They want someone that, "Hey, how you going?" and can have a good talk to. And take time out. I'd rather sit there and talk to someone than go sit at the desk and have a coffee.